compared to 12th graders, a significant increase. But there isn't that much of a difference in the rates among 12th graders and college students. So really, it seems like almost like college-age drinking, if you will, starts in the 12th grade. Yeah, when it seems to be. This is sort of an interesting sort of analogy. You know, the pediatricians suggest that alcoholism and alcohol and drug problems in teenagers and young adults, it's like a contagious disease. It has similarities because some people catch it somewhere between the 8th and 10th grade. That's when addiction commonly takes hold. It spreads among friends. In other words, who you hang out with, peer pressure, is a factor in who develops it. Just like other communicable diseases. There's a latency period, like with other infections. Okay? It doesn't like, it may start in 8th or 10th grade, but it festers for a while before it really takes off. There's a latency period. There's a lot of shame. In other words, that concept is that if you keep secrets and don't talk about the underlying problem, shame builds up. And I guess that's sort of a medical analogy about it being exposed to oxygen or light. It's important to talk about the problems to help prevent them. The risk factors that go into who develops it in age has to do with, we know that people with low self-esteem, who have a family history, and other psychiatric illnesses, like we talked about in the first section, psychiatric comorbid issues, including ADD as a risk factor.
For college-age drinking?
Yeah, absolutely. And college-age drug usage too.
Yeah.
Stimulants, cocaine, crystal methamphetamine. There's protective factors that they found in some of the studies that what helps decrease the risk. Well, studies have shown that young adults that are connected to 3 adults, it's interesting that it wasn't just parents or 2 adults. The studies showed that when they did these studies on young adults, if they could identify 3 adults that they considered themselves really close and connected to, they had a much lower rate of developing addictions than people who could only identify 1 or 2. Interesting study. Studies showed, of course, families that sit down and eat dinner together have lower incidences of addictions. And then, of course, kids that participated in after-school activities, sports, and clubs definitely had a lower incidence of developing addictions. So those sort of after-school programs really do help. When talking to adolescents, you should and evaluating them, the pediatricians, again, this is sort of their thing, they suggest you should ask them if they've ridden in a car with other friends that were drinking or using drugs. Did they use alcohol or drugs to relax? Did they ever drink alone? You know, it's different if you're drinking with your friends or parties, you come home and drink alone. Do you forget things when you're drinking or using drugs? Are your family and friends concerned? Have you had trouble as a result of it, trouble at home or school? So these are some of the things that they suggest as a way of evaluating young adults and college-age kids. When you're talking to adolescents or young or college-age kids about drugs and alcohol, you shouldn't tell them what you know about it. I have to make sure I don't do that, right? I'm pretty knowledgeable about this. When I sit across from an adolescent or young adult, it's not going to do me any good to start telling them what I know. What's better if I can ask them what they know about it. And what really helps is if you can ask them, they usually won't tell you if they've had any problems or issues with drugs. But if you ask them about their friends, they'll usually tell you what their friends have been up to, the problems their friends have had as a result of it. Then you get an idea what's going on with them. They will never tell you, but alcohol and drugs causes a lot of hurt and pain. We're going to talk about that in a minute. 44% of the college students have binged in the last 2 weeks. 44%. What's a binge? It's more than 5 drinks at a time for a male or 4 drinks at a time for a female. 28% of the are binge drinkers. Okay? A binge drinker is someone who's had 6 binges in the last month.